6 months into the worst Ebola epidemic in history, the world is losing the battle to contain it. Leaders are failing to come to grip with this transnational threat.
That was the message that came from MSF asking the world to take action when the Ebola virus began to spread, and action they took, with various charity organisations, individuals and countries sending in tons of resources, food, medical and non-medical experts, along with millions and millions of pounds and dollars to combat Ebola. The response to the 2014 Ebola outbreak was huge, and it was done in a colonial way, with France supporting Guinea, America supporting Liberia, and Britain supporting Sierra Leone.
It's very tricky to identify Ebola without a laboratory test. I mean, many of the symptoms of Ebola are common to other infections as well. So it's things like diarrhea, sweating, high fever, and then there are more unusual things like hiccups.
Last week we came to a village where we had around 40 patients from one village. It's unbelievable. I never have seen it before.
The time is going, and every time you have more people contaminated, and then one people can contaminate many.
Here is a map of Africa showing the worst affected countries in the west coast. First, it was the Republic of Guinea, with a population of 11.75 million people, was the first West African country where the 2014 Ebola virus disease struck, wherein a 2-year-old boy in a remote village of Milandu fell ill on the 26th of December 2013, with a mysterious illness characterised by fever, black stools and vomiting, and died 2 days later. The World Health Organization took 3 months to confirm that child's mysterious death as West Africa's first case of the Ebola virus disease, and by which time the virus had spread widely. Despite the fact that Guinea was the first affected country in the region, it had the least deaths of just 2,382 and 3,161 laboratory-confirmed cases. Then it was the Republic of Liberia, the second country in the region to be affected. It borders on Sierra Leone, Guinea and Côte d'Ivoire. It has a population of 4 million people. Liberia, a country which has managed to survive 2 brutal civil wars in a short space of time, killing well over 300,000 people, has now lost a further 4,608 Liberian lives to Ebola, and had 3,151 laboratory confirmed cases. Then it was the turn of the Republic of Sierra Leone, one of Ebola's hotspots in the region. A small country with a 6 million population was barely managing to recover from its 10 years of civil war, which ended 15 years ago, when Ebola struck it hard. Sierra Leone was one of the worst affected countries in the region, yielding away 3,901 lives to the virus, and had 8,590 laboratory confirmed cases. Then there were the least affected countries in the region: the Federal Republic of Nigeria, the Republic of Senegal, and the Republic of Mali. Starting with the giant of Africa, the Federal Republic of Nigeria had 19 infected people and 7 dead. Senegal had just 1 case and no fatality, as they were able to put an end to the virus quickly before it spread. And finally there was Mali, the 8th largest country in Africa, had 6 deaths, of which 5 were confirmed as Ebola, and 1 probable.
When I first heard about the Ebola outbreak, we weren't really sure how bad it was, or I certainly wasn't sure how bad it was at that time. So we were obviously concerned. I knew of Ebola, but I hadn't heard that much about how infectious it was. So I immediately did a bit of research, and once you understand the symptoms and the transmission of Ebola, it's obvious that it's an extremely serious disease. And obviously, as a medical organisation, we're able to supply doctors and resources to treating the outbreak, but we're only one organisation. So we called upon the international community to step up and get involved, because we knew that alone this would be an incredibly difficult outbreak to manage and respond to.
Many of the member states represented here today have invested heavily in biological threat response. You have a political and humanitarian responsibility to immediately utilize these capabilities in Ebola-affected countries.
And I think it's fair to say we struggled as an organisation to manage the caseload. There was vast numbers of patients coming through, and with a disease like Ebola, there's not that many people who are adequately trained to respond to that kind of disease and operate safely. So it was difficult to have the manpower to actually respond to a disease like Ebola.
In order to increase the number of staff to respond to the outbreak in West Africa, MSF organised several training courses for experienced doctors, nurses and water and sanitation specialists at their Espace Bruno Korb training centre in Brussels. The objective is to ensure that all trained staff have a sufficient knowledge of the disease, its transmission route, and how to safely and efficiently perform their duties in an Ebola management centre.
You just drop the stretcher on the floor, and then you will have to carry the patient on the...
So you have one more. Oh, don't go under. Don't go under. You got one more right here. Look down. Take that off. And then reach behind. Reach behind.
My name is Fatima Cabello. I'm part of Spanish Red Cross. I work in emergency response units as health advisor, and I'm here in the training because we are running operation together with International Federation of Red Cross in Sierra Leone at the Kenema Hospital. We are setting up a 60 to 100 bed Ebola treatment center. MSF is the most experienced organization in Ebola, so yeah, some organizations are attending this training.
MSF also provides psychosocial support for those infected with Ebola to help them to cope mentally with the virus and its stigma. They also employ and train Ebola survivors to work in various roles as they have a first-hand experience of the disease and they know what the patients are going through.
I've been to Sandy Massakoy, a mental health counselor. I was affected. I was treated by MSF. Then really, I think I know exactly how they are feeling when they are in there. When I explain my own situation to them, explain my own story, some of them really cope up, they take it into consideration. So I really hope I'm trying for them. When you are first taken to the treatment center, it will not be easy. One, the fear, maybe you may be scared of thinking that you may die, because many people were dying then. So I was afraid, really. So I just decided to keep my heart off, my mind off the sickness. I just focus my attention to the treatment and pray to God that I get well. Trying to set up a survivors association. Really, there are children among us which have, some of them do not have any family. In fact, there are some married women who lost their husbands and their children also. We have students among us who have lost their parents totally. So for now, if schools reopen, they don't have any support. We may need support, really, because we would like to really help them. We just have to put hands together. I'm still appealing that we put hands together to end this Ebola, because it's really affecting us. It's affecting not only us, but also the children.
Doctors Without Borders has set up a maternity service annex to the Ebola treatment center that we set up in Freetown, in Sierra Leone. The aim of this service is to provide the best care possible to pregnant women infected with Ebola. We try and provide specialized care for these women who have special needs, and we try and increase their chances of survival. The maternity service has specialized staff specialized in obstetrics, midwives, gynecologists, and other ancillary staff, and we are setting up specific protocols to ensure that the support treatment is the most adequate possible to reduce the complications associated to bleeding and to other complications that could accompany a delivery or a miscarriage.
Here you will start with this one today, tomorrow, okay? But so this week that you take them, you will have your period, you will bleed.
So Adama arrived, we knew she was pregnant. We didn't quite know exactly how far along. She ended up losing the pregnancy quite early on, and some complications from that extended her stay in the confirmed tent with us, but she's now recovered. But of course, there's a lot of trauma and psychosocial support that'll need to come with having lost a pregnancy. Also, some of her family members have also died. So now this is just one part of her journey now that she's recovered, but a big step will be going home and kind of the aftermath of everything that comes with Ebola.
We're at a stage now where cases are declining quite significantly, but it's not over yet. And I think we all have to be extremely cautious not to get complacent and to feel like our job is done, because it's not. So what we're doing now, we're moving away from simply treating existing cases of Ebola in our Ebola management centres, and looking more towards community outreach. And that involves sensitisation of communities to ensure they understand what Ebola is and how to respond to it if they suspect that one of their friends, their family, their neighbours might have the disease, and to make them aware of all the preventative measures, basic hygiene, hand sanitisation, and what to do if they do come into contact with somebody who probably does have Ebola, i.e. not to touch them, not to come into contact with their bodily fluids. So there's an ongoing uphill battle to make people aware of this virus, even now, although obviously over this last year people have become more aware of how the virus transmits. Our job is still to make sure that those messages hit home in the right places.
My friend was very sick. He was very seriously sick because he was bleeding. I never knew it. The time I visited him, he was just like vomiting. But fortunately, he was here. He made it. So that was very sad. That guy was Ebola positive. So that is how I came about the virus. I was scared. I was really scared because I was not like other people who get interact with others, because I'm always at home. The day I'm alone here, I left alone in this place. At the time I got scared. I have all sorts of nightmares. My lovely mother brought for me this flower, so I scratch it. Valentine, yeah. The last but not the least, MSF.
And what is this one? Can you explain?
Spider-Man.
Your result is out. You are now negative. You are free now from Ebola.
Yes.
So, they are coming to discharge you now. Are you happy about that?
Yeah, I'm very happy. Never thought it that I'm going to make it. But by the special grace of God, I made it. So happy.
The treatment in the management centres, certainly to begin with, it was quite limited compared to how we would be able to respond to other viruses or trauma injuries, for example. When we started responding to Ebola, there were no vaccines in development, and there were no drugs proven to be effective against Ebola. So essentially, you're providing food, water, sanitation, and pain relief. And for doctors, for medical staff, that's incredibly frustrating to not be able to do more and to offer more. But I think we've shown that even that basic level of care does make a difference and does reduce the rate of mortality in those patients that are affected, just having that basic level of care, being well hydrated, well fed, and trying to manage their pain levels.
Here is a short video explaining the different phases for the clinical drugs that Medicines Sans Frontières or Doctors Without Borders are trying to develop.
At the end of 2014, MSF launched the first clinical trials for Ebola treatments in 3 of its centres. So let's find out what's been happening. First of all, how is a new drug developed? The process starts with preclinical trials to evaluate, select, and transform the most promising molecule. Then it's on to the clinical trials. During phase 1, the drug is administered to healthy volunteers to gauge possible side effects. During phase 2, it's administered to patients to assess efficacy and determine the appropriate dose. The third phase compares the tested drug with an existing treatment or placebo. And once all these trials are successfully completed, the drug is ready to market. Under normal circumstances, the process takes up to 10 years. Due to the scale of the Ebola epidemic in West Africa, the World Health Organization agreed in August to fast-track clinical research. This meant that clinical trials would be launched on 8 drugs viewed as particularly promising. What are the guiding principles? Streamlining and adapting research protocols to the setting, producing drugs swiftly and making them available in sufficient quantities at an affordable cost, informing and working closely with the authorities and local communities to ensure their commitment, and sharing results as they become available. In November, MSF announced that 3 clinical trials would be conducted in its treatment centres in West Africa. Tests began in Guinea and Liberia on favipiravir and brincidofovir, 2 orally administered drugs. The brincidofovir trial had to be cancelled almost as soon as it began due to a lack of patients. The third trial, also in Guinea, is assessing the efficacy of transfusing blood products from Ebola survivors to infected patients.
This trial has been started in March 2015 in the region of Conakry, in the prefecture around Conakry as the Basse-Guinea region. We have tested these vaccines for more than 1,000 frontline workers, and the rigged vaccination approach is to try to demonstrate an efficacy that we vaccinate more than 4,000 contacts of patients, and that has been implemented by the WHO on the ground.
C'est le personnel médical qui est plus exposé. Donc, en tout cas, moi je conseille à tout un chacun de nous de venir y prendre. On ne sait jamais dans la vie. Parce que c'est nous qui sommes en contact direct avec les malades.
There is no major side effects, and that means that this product is quite safe. The other, of course, very important information is basically that this vaccine shows an efficacy around 100%. This is the first time in the history of the disease that we demonstrate an efficacy of a preventive tools as a vaccine. I hope that this vaccine will stop the Ebola disease transmission. We probably need to include this new evidence, these new tools, to the normal component of our intervention, not only in Guinea, but as well in Sierra Leone and in Liberia. That's why we would like to propose to the different national health authorities to consider this ring vaccination approach, but as well to vaccinate the different frontline workers, and probably we should as well envisage to vaccinate the partners of the survivors. It will be the unique opportunity, and it will be a missed opportunity if we don't do so.
This is the most dangerous moment and the most critical moment in an outbreak, because the cases were going down and down and down days after days, and people start to relax. And this is when we get accidents. When we're in outreach, it's us alone, 4 or 5 people in a team, alone inside there. If we have an accident, the time we come back with the traffic and everything, yeah, it is. I think it's very dangerous. Yeah. 4 times out of 5, we go inside houses where the patient has been confirmed with Ebola. So yes, there is probably Ebola virus still alive around. When you enter, you got loads of sharp stuff around. You see all those roof covers and stuff. Sometimes you got really sharp stuff. The atmosphere between my team is extremely important for them to feel comfortable, because it all relies on each other. And it's the entire city who relies on us for cross-contamination control. When we go inside, once we dressed up, is a complete walk into the unknown. We don't know what we're gonna find. We don't know how big is the place. We don't see much. I mean, 9 times out of 10 people don't have electricity. It's very, very dark in those places. It's all about finding the line of what really needs to be disinfected, taken out, left under the sun, and what can actually be left inside the house, so those people do not feel that we've been too much into their private life. All time we got a health promoter. We constantly keep explaining every single moves we are doing, because it makes people feel a lot more comfortable. It makes them feel safe. They understand why we are doing this, what we are doing.
The other plastic, the thing that we're not going to use again.
Doing it this way, we can walk inside the community, have a real human exchange, human chat with the rest of the community. They see that we are human. They see that our operation is under control, and then that's when we dress up. For me, Ebola, until we got the very last case in the country, it is not over.
So a colleague of mine, Ivan Gayton, came up with the concept of developing a waterproof tablet device that could be used inside the high-risk zone in the Ebola management centres, and effectively it allows you to log patient information such as temperature, blood pressure, any vital signs, as well as general notes about how that patient is doing. But the advantage of it being waterproof is that it can stay inside the high-risk zone and be easily disinfected using chlorine. And that device is actually linked to a server, so all that information is fed back to a computer. Before that, we were having to use bits of paper which can't be taken out of the treatment centre outside of the high-risk zone, and so essentially patient information would have to be shouted over the fence. So this device actually simplifies that whole process. I think overall MSF built up a number of relationships with existing organisations and the Ministry of Health of each country affected, and it was important to establish these relationships and act in partnership with them in order to offer the best way forward in tackling this outbreak. There were some differences of opinion in terms of how the disease should be managed and tracked, but ultimately on such a large-scale, widespread outbreak, you have to be collaborative and use all the different tools at your disposal.
This is the arrival of the British military medics in Sierra Leone to help combat Ebola under Operation Gritrock. The British Army brought with them tons of equipment and resources, such as their high-profile military ship HMS Argus, where they admitted and treated those who are infected with Ebola. They also set up the state-of-the-art Kerrytown Ebola Treatment Centre, where they provided lab services to test if someone is Ebola positive or not. The British Army also helped to train over 100 volunteers to prepare them to combat Ebola in the front line. The UK has supported more than half of all the beds available for Ebola patients in Sierra Leone, funded over 100 burial teams, trained 4,000 frontline staff, provided 3 labs to test 1/3 of all samples collected nationally, and delivered over 1 million PPE suits and 150 vehicles. Oxfam distributed thousands of kits to help quarantined communities across Guinea, Liberia and Sierra Leone.
I'm Gemma Kearney. I'm an Oxfam ambassador and have been supporting Oxfam for a few years now. I'm in Sierra Leone finding out what Oxfam has done to help during the Ebola crisis. So far, the Ebola outbreak has claimed more than 11,000 lives. The lack of water and sanitations in places like health centres and schools creates conditions where disease can easily spread. Though the number of infections has dropped since the height of the outbreak, West Africa still has a long way to go to become Ebola-free. In Sierra Leone, there are currently around 11 new Ebola cases a week.
Oxfam, they came here twice. From there, they gave the children toys, they gave soap, they gave books, pen, crayon, eraser, ruler, and also that's a calendar for the children to study.
Coming to Sierra Leone has made me realise that it was the people without the most basic needs, water to wash their hands, hospitals within reach, toilets to use, who were hit the hardest by Ebola. Although no one was safe from the disease, it was the very poorest people in Sierra Leone who were most affected by the Ebola outbreak, and we need their voices to be heard now and in the future. Oxfam has been helping to fight the Ebola outbreak and will continue working in affected countries for the long haul.
Well, today we're loading 40 tonnes of vital water and sanitation equipment to go to Liberia from our emergency warehouse in Bicester in Oxfordshire. This aid will be vital in providing clean water and sanitation for people in Liberia, and tomorrow we'll be sending a similar amount of aid to Sierra Leone, where the crisis is getting worse. People desperately need clean water. Clean water keeps people alive, and it will help stop the spread of this horrendous disease. We're winning the battle against Ebola in Liberia, but we're far from winning the war.
In response to the Ebola crisis, we started off doing radio jingles, working on sort of mass communication to increase awareness, as well as providing hand washing stations and soap, sort of basic items. And our approach has moved as the disease continued to spread, and we started both responding to the need for more beds and constructing these community care centres, so these Ebola community care centres. Another focus of our work has been to increase the trust of the community in both those facilities, also in coming up and coming out with, if they do have symptoms, and ensuring that they are referred and go to the facilities that are available to them.
Based on we as the indices of this chiefdom, as the chief, they told them that if there is any problem, chief,
an Oxfam is more than 100.
It's more than 100.
So we will listen to the plans. We will work to help improve the water supply and the sanitation, and to support the people in quarantine.
Okay. Oh, opportunity for faith. Quel plan nous? Un plan, un minute for faith.
Oxfam provides support for quarantined households by giving them food, hand washing stations to break the transmission of Ebola, along with drinking water. Oxfam also have a team of decontamination experts who are responsible for spraying every quarantined household with chlorine.
The approach that we've taken is twofold. One is through these community health volunteers going out, actively going door to door. And the second has been working with the communities for them to come up with an action plan, ensure that they know the risks, ensure that they know where to go and so on, and for the community to come up with those solutions. Because it's one thing having the beds. Now in all countries there are enough beds, but it's actually getting the communities to trust the system as well. So that's another aspect of our work, is also about raising awareness of the facilities and what happens when you enter, the fact that you can visit, that there's ways of seeing your relatives, that you can keep in touch with them.
This is New Crew Town in the outskirts of Monrovia in Liberia, and we're going round with the community health volunteers to find out what they're doing to prevent the spread of this deadly disease. So it's a good area to have a look around and find out how Oxfam is helping with these community health volunteers to reduce the spread of this disease of Ebola.
Today I'm just going around carrying online awareness concerning what I was taught from the workshop from Oxfam. There's a reason you see me on the feed today, trying to carry on an awareness, talking to the people, making them to know about Ebola is real, giving them the understanding of the prevention measure, how to prevent themselves from Ebola, how to do things that will not cause them to be sick. These are the things I've been doing in the community today.
I made myself available because within the community we know most of our people, they are novice, they are not very educated, they don't know these things, and we ourselves as our Liberians living in the district, we the only person there to educate our people. We now expect somebody to move from Singapore to can't tell me what is this. So I make myself available in order to save my community and that of the country. Get me? It's simple. If don't want you to come out first, we're going to go back in. But somebody say, yeah, there you standing way over there. Then just imagine your mother that bore you on earth. You're looking at her dying. Give me water. You cannot get closer to it's scared. It's bad. But then according to this, at least we are trying.
We've just been following some community health volunteers go around the community here in New Crew Town, just outside Monrovia, very poor area. They've been knocking on doors and giving people information about how best to avoid this deadly virus of Ebola. What people are telling us is that they're a little bit confused about what is Ebola and what is the difference between that and malaria, and when people catch a certain disease, how do you know it's Ebola? It could be malaria, it could be diarrhea, it could be other things as well. So there's still a great deal of work to be done here. People, though, are washing their hands very regular here, and that's really important for their health, not only against Ebola, but all sorts of other diseases. So once this terrible crisis is over, if people can maintain those high levels of public health, then diseases of other things will drop down as well. So hopefully things are moving on. There is less a sense of fear here, and certainly it looks as though the work that's been happening here is making a difference.
So we've reached 1.1 million people across both countries, and we've provided both that extra capacity working with these medical partners, these holding centre where people could go get tested, and then they're passed on to the Ebola treatment units, but also the work at the community level. A lot of cases were referred through our volunteers. So it's been a really effective way of getting people to use the facilities, working with them and going door to door. And what we found, especially in Liberia, is that, and also more recently in Sierra Leone, that now people are voluntarily going to be tested as soon as they have symptoms.
I'm Stephen Saga, 30 years of age. I'm now taking care of 13 children. I lost 4 persons, which includes my mother, my father, and my 2 sisters. I myself and my fiancé was very ill, and we take ourselves to the MOD treatment unit in Congo Town to seek treatment. Since I came from the ETU, I lost my job. I have nothing to do. I'm just doing a little contract, doing some construction in the community just to help myself and my brother and sister to carry on living. Life is really difficult. Yes, things are tough. It's not easy. To take care of 13 persons is difficult. We hope to put them back into school, make a living a little bit better. Yes, good shelter and things. We hope the future will be better.
Hygiene kit. When a bucket, soap, chlorine, pad, and get messages the way we go tell now how for use them. Particularly chlorine, then go fix them this way. When this all man go put on a door for wasan, yeah? And so you fix them this way. This gift come out from outside. Inside this gift as well, you get soap. Any bucket gets 7 soap inside it. From there, this other bucket, this is for begin. This is for begin. And inside this bucket, you for begin. You get 3 pads. When this pad for the one, they will start with this pad.
I don't think that we should stop the awareness raising around Ebola. And we as Oxfam strongly feel that we need to continue on what has been achieved to date, both around the primary health unit, both around the understanding of Ebola, its risks and how to prevent its spread, and also ensuring that other aspects such as the economy and investment in jobs, especially sort of agriculture and fisheries, which is the main sort of employer in Sierra Leone, that happens as well. So I think the messaging, the health facilities need to be prepared and ensure they've got the right infection prevention control, etc.
Life has been very difficult, yes, since the outbreak of Ebola, because to get food to eat, I'm a single parent. To get food to eat is not easy. Before the Ebola, we were getting food like to sell to support my children, and when I carry the market in a place, people buy them. But now, hey, even if you go buy in the stove,
and you bring it to get better. It's not easy. So I'm just appealing to the international community to kind of help us. We, the single parents, that they should please at least empower us. That because when Ebola finish, life will be very difficult for us.
The story on controlling the epidemic in Liberia and in Sierra Leone and Guinea is much more positive. So what we are calling for now is that as we move into the recovery, the world really gets behind these three countries. They were desperately poor before. Their weak health services were one of the reasons the epidemic spread so fast. So we're saying, let's get children back to school. Let's get health services restored. Let's inject some capital in a way that gets poor people having some spending power. People have lost income. They've lost jobs. Many are going hungry. So we've got to get behind that recovery. We'd like to see action happening fast. We'd like to see the governments of the three countries publish their plans for the recovery, donors to pull together at the conference that commits in the long term and pledges significant finance to support it. But we can't wait months and months for a plan. The most urgent thing is to actually get the economy running again, to get schools running, to get people using health services. So there's two stages, an initial injection and then a longer term partnership.
Thousands of children have been made orphans by the Ebola outbreak in West Africa, and this is where organisations like Plan International and Save the Children come in, to provide care, protection and homes for these children who have lost their parents to Ebola.
Together, 6 people died. My big brother and my little brother and my little sister. And my 2 mothers.
How do you feel now?
I'm not feeling alright.
What killed them?
Ebola.
Our father was the first. 6 minutes to 9, our father died. My uncle, the late side, died. 5 minutes after 9, my older brother, Junior 7, died. 10 minutes after, and he died 20 minutes after 9. That was on the 29th. And then on the 30th, my auntie, Bendu, my sister, and one of the nurses from the hospital, Sis Mercy, they also passed off on the 31st after talking to my little sister Jibento before walking from the ERW compound to the gate. My sister passed off.
Just dying. Sometimes before you wake up, you see, oh, your daughter is gone, your son is gone, your husband is gone.
These are 3 children of one mother and father. Their mother died, the parents died in Foya. And when she came with the 2 children, the friend said, no longer you can come, I can accommodate you because the children you brought, you people came from a place or your parent died of the virus.
My name is J. Soka Moses. I am a medical doctor, a Liberian. We are overwhelmed with patients. We have so many patients that we don't have bed space to accommodate everyone, so we put the extra patients on the floor. We've had so many children that are orphans. I cannot give you the exact figure today, but now some of these children come with their parents and the parents die in a unit, and then so they are going home. The youngest we've had is 6 months old, a 6-month-old baby whose mother died of Ebola. The baby was also positive, but he was killed and we've discharged him.
My mother, the time my mother was sick, they not wearing the thing. La former just opened the car, then my mother put inside. The black people came from my salon. I was scared and looked like spirit.
Yeah. You see her smiling? She could not even walk, she could not even sit when she came for admission. Today she's sitting smiling and she's feeding herself. Okay, another patient just walked from the wall. You see how strong she is? Yes.
I actually got in contact with some survivors, and they found out that some of the survivors have children, and most of them are orphans. So the survivor that is now present has about 4 or 5 children, which she is taking care of, and most of their parents have gone.
So we're praying that this thing work out so we can get back on our feet and see how best we can bring this family back.
Plan is a child-focused organisation, and therefore everything we do takes into account the needs of children and also child protection. So at the start of the emergency, we set up a number of teams within Sierra Leone to work specifically on the issue of child protection and also to take care of people that are orphaned through Ebola. We set up a number of care centres. We don't call them orphanage, we call them transitional care centres, where children were taken in and provided basic services, care, psychological support and protection until we could find either a member of their family that was able to take them in and look after them, or if there was no member of family we could find, we'd find them a foster care home that would be able to take them in and support them. When the Ebola crisis broke, it became a crisis of international concern, we already had a number of projects in Sierra Leone, so we were in a very good position to be able to respond to the crisis. So as soon as the crisis started, I was asked to take the lead in Plan UK. I set up a task force and we sent a number of people inside Sierra Leone to talk to the Sierra Leone government and also to some of the major donors, particularly DFID, which is the leading development agency for the British government. And we said, look, we're here, we have teams on the ground, we have people trained to respond to emergencies, what can we do? And DFID asked us to do two different activities. Firstly, they asked us to take part in quarantine activities. So when a family has someone in it who has Ebola, they cordon it off to make sure that people don't leave during the 21 days, which is the incubation period for Ebola. And then we provide them with food and water for 21 days. A basic package of rice, dried fish, oil and flour, and sugar and salt. They varied slightly differently depending on in what district, and also during the crisis it's varied slightly depending on what WHO recommends those food packages to contain. So we've distributed 31,000 food packages, which has benefited an estimated 80,000 people who are living in quarantine communities or have been during the crisis. But you've also got to decontaminate the house where they're in. So you take out the person who has Ebola and then you spray the whole house with chlorine, and you also remove any objects that might be contaminated. To do this, you need to be able to train large teams of volunteers who are able to go into the house dressed in protective outfits, decontaminate the house and remove those objects.
So when we come, we'll disinfect the ground where we're going to dress. After disinfecting the ground, we're going to spread that plastic. On top of it is where this guy's going to dress and be ready to go inside.
When it comes to households that had had its household members reported or suspected with an infection case, having the house being decontaminated is very important. Things in the house such as tables, desks, cooking utilities, the mattresses, doors, windows, basically every corner of the house needs to be decontaminated.
We try to tell them that the chlorine that they are so scary about is not something that will kill somebody. The chlorine is there to protect them. We are the last that comes in any community. After we've taken the contaminated materials outside, we disinfect the house, and also we take them to the dumping site and we supply them new beddings. Our aim is to break the transmission of this disease.
Well, our overall goal was to contribute towards the eradication of Ebola in Sierra Leone and in West Africa. Now, we are very proud of what we achieved. We obviously didn't do that on our own, we did that with many of our partners. But we haven't eradicated Ebola. There is still 5 cases, I think, currently in Sierra Leone, and we're currently supporting 50 quarantine families. So we weren't able to reach our overall goal, even though that we are very proud of what we've managed to achieve, because now at least we're dealing with manageable numbers. Our other goals were related to providing support and protection to the most vulnerable people in society during this crisis, and most of our activities were focused on children. Throughout the crisis, we've been able to provide basic protection services to children, and particularly to young children under the age of 5 and adolescent girls.
We've just come back from Port Loco, the community care centre, where we saw a number of nurses and cleaners and sprayers, and it was quite amazing really. And they're having a quiet day. The week before they'd seen something like 67 patients, but in the last 48 hours they'd seen just 1, so that's a real change for them. We spoke to the nurses and they've been there since the 6th of December. They haven't been home. That's where they eat, sleep and live. Partly they don't go home because of the work, and there's been so much work to date, but also because of the stigma in their local communities. We also met Francis, who is a community coordinator. He goes into the local communities and finds people who they think might be ill, and then he helps bring them to the centre. Sometimes people just walk off the street, and when they first arrive they go to the triage area where they're assessed by a nurse, and if they're thought to be ill then they go into the red zone. We met all the different workers. It was interesting how upbeat they were. They're very grateful that their workload is decreasing. That's a good sign with Ebola going down, so hopefully that will continue. And they made us very welcome, and it was very humbling to meet them and see the fantastic job that they've been doing over the last couple of months.
At the start of the Ebola crisis, the idea was to get as many people who had Ebola or had symptoms of Ebola into hospitals and care centres. However, there simply weren't enough doctors and nurses in the country to be able to provide this professional type of healthcare. So we worked with the WHO, the World Health Organization, the government of Sierra Leone, and also DFID to set up and design community care centres. These are essentially clinics which have some professional oversight from a doctor or a nurse, but are essentially run by community volunteers. And we set up 7 of these clinics, which so far have seen 1,400 people that have Ebola. We take them in, we provide them with the type of support they need. If they're very bad cases, and it's possible, we try to move them to an Ebola treatment unit, but in many areas Ebola treatment units are too full, so we have to take care of people from the start of their symptoms showing through to them surviving Ebola, or sadly in some cases to them dying, and then we pass them on to the burial teams. Our biggest objective now is to try to get people safely back to school. Schools are now opened across Sierra Leone, but attendance rates are very low. People are very scared about children being around other children and possibly catching Ebola. And therefore we've put a lot of energy into decontaminating schools and trying to raise awareness with the community about the importance of education and about the fact that teachers have now been trained in recognising symptoms of Ebola, and there are isolation units at the schools where we are working. So if the child does have any symptoms, they can be quickly isolated, therefore protecting the other children and making sure that the person that does have these symptoms can get the attention that they need.
This is a condition where you cannot touch your close relative, neither your mother or your sister.
For your family, do they worry or are they upset that you work here?
Yeah, for the starting when I call them, I tell them they will hurry, up till now they are hurry. But still I'm talking to them, not to be fair, because I am involved for the job, so they don't continue to only pray for me while I'm taking the precaution.
I had a colleague who lost, we lost him, we lost his wife, and all his children, and even his mother-in-law. Yeah, the other one, we lost him, but he was quick to recognize the signs and symptoms of the illness because he knew he has exposed himself. So what he did exactly was, he told his wife, nobody comes near me. If I have to die, I'll die alone. And he died.
As for now, I'm not with my family because while I'm here doing the job, my family is no more happy for me. Yeah, they ask me to leave the house because of the work that I'm doing. And they say that I should not supposed to spread the sick in the family. You understand?
After a day's work, I make sure I disinfect my shoes, I wash my hands, and make sure my Honda, my motorbike is disinfected before I go home, because I knew my children would come to greet me.
The work is hard, but no way to do. It is our whole war. It is our whole war for the nurses. No way to escape the war. We just have to fight it, so that we can eradicate Ebola.
One thing that I say in all my meetings I have on Ebola is that it's been a major challenge for the international community, and the international community hasn't got everything right, but it has worked together along with the countries that have suffered from Ebola to be able to fight Ebola. And I think that our efforts, which have been supported by hundreds and thousands of people around the world, have really made a difference to these countries. I've been travelling regularly to Sierra Leone and I've seen the difference on the ground, I've seen operations working. But I also think it's important that we highlight the work that people in places like Guinea, Liberia and Sierra Leone have done. They are the real heroes in the fight against Ebola. They're the people that have given up their time, have given up work to be able to support the process for eradication of Ebola. These are people that at times are illiterate, people that can't read and write, but they do know the dangers of Ebola, and they're willing to take on the risk of working with people that have Ebola. They're willing to go into houses and decontaminate them so that they can prevent this deadly disease. And I think it's right and proper that their work, their dedication is recognised, because they're the people that have really championed this cause, and as I say, they're the real heroes of the fight against Ebola.
Here is a chart showing the world's financial response to help combat Ebola in West Africa. The United States of America gave the largest donation of £466 million, which is around $727 million, plus health professionals and Navy personnel. The World Bank donated £248 million, the United Kingdom donated £125 million. The African Development Bank gave £93 million, whilst the International Monetary Fund gave £87 million. Germany poured in a sum of £81 million, France poured in £55 million, Canada donated £35 million, the Gates Foundation donated £31 million, the Japanese poured in a total of £25 million, and the Chinese poured in £20 million. The Facebook millionaire Mark Zuckerberg donated £16 million, India contributed £7 million, and finally Paul G. Allen's Family Foundation also contributed £7 million.
So through our partners in Liberia and Sierra Leone, sensitisation has been done in a few different ways. First of all, it's about working with leaders of different organisations and different faith groups. So that's coming alongside church leaders and imams, and actually working with them both equally to provide information that means they can reach out to their communities, to those that worship in their churches and in their mosques. It's also been about going into communities with people from that community and spending time with people, answering questions and really explaining in a simple way how they can avoid getting Ebola, signs and symptoms to look out for. And then of course also working alongside the government through our partner organisations in both countries to make sure that during government initiatives such as the lockdowns in Sierra Leone, that our partners have been cooperative and providing support to reach out to those that maybe haven't got the message through. I also think sensitisation is an ongoing thing. It's not something that you can do just once. And all of our partners in Sierra Leone and Liberia have been really committed to making sure that the messages around Ebola are not just given once, but that they're repeated and in different ways with different people, especially those most vulnerable, such as the disabled or the elderly, people that maybe cannot get out of their homes so easily or need assistance to get about in society. It's really important that those people have been given extra time to make sure that provision is put in place for them.
It is clear that the world and some of its wealthiest individuals and some of the biggest organisations have contributed a wealth of resources, finance and manpower into the outbreak, and yet Ebola still continues to scourge West Africa and its people. With continuous support and research around the world, the scourge known as the Ebola virus disease could one day be eradicated.
Do not stand at my grave and weep. I am not there. I do not sleep. I am 1,000 winds that blow. I am the diamond gleamed on snow. I am the sunlight on ripened grain. I am the gentle seasonal rain. When you wake in the morning hush, I am the swift, uplifting rush of quiet birds in circling flight. I am the soft starlight at night. Do not stand at my grave and weep. I am not there. I do not sleep. Do not stand at my grave and cry. I am not there. I did not die.